Below the Skirt with Tamara. Hi, my name is Tamara Green, and I am a pelvic physical therapist, and I help women like you overcome that uncontrollable bladder, return to that oh so pleasurable sex, and manage your pregnancy symptoms so you can become a postpartum champion. So I'm going to be discussing just about when it comes to this bladder. And if you're someone who's had a C-section or abdominal procedure, I need you to really tune into this. If there's someone you know that has had some type of abdominal procedure. Now, when you have the procedure, and I'm going to bring in Virginia, like I always do, my girl Virginia, below the skirt. So, Virginia, when you have an abdominal procedure, what happens? You have scar tissue. So if I cut my arm here, what's going to happen? Yes, it's going to heal up, but some of us heal a little bit differently. So we have some of that scar tissues, what we also call adhesions, and they can get kind of sticky like little weeds. So when things are healing how they should be, or trying to get back to what possible normalcy is, what happens, those adhesions can stick to the bladder. So if you touch the front of the bone at the front of your pelvis, the pubic bone, right above that, sometimes you can tap that and you may feel like, oh, I may have to use the restroom. Well, that bladder sits right here. So it sits right there. So with this sitting at the front of the line of all the organs down there, when you cut through, some of that adhesions can get stuck to the bladder. Now, when it's stuck to the bladder, the bladder's job is like a big balloon. It's a little balloon. It's like a water balloon. You put water in the balloon, what happens? The water expands the balloon. It's the same thing as the bladder. So when it is expanding, it may not have the capability to expand or contract how it needs to, because it's kind of stiff because of the weeds of the scar tissue that may be attached to that from the adhesions or scar tissue from the surgery. If it's a hysterectomy, or if it's say you've had a hernia repair, something, C-section, something that's had caused some type of surgery. Now, the job of the bladder is to expand when it fills with urine, and then when it's time to go to the bathroom, what happens? It contracts. But if it doesn't have the capability to do those things, then you may have that sense or that frequency of needing or urgency to feel like you always have to go to the restroom. So having to go to the restroom has nothing to do with, can I control my bladder? Your bladder may not have the capability to do it because it's not able to expand or contract to be able to do what it needs to do. So you may be dealing with this little water balloon versus a big water balloon, and then you can't hold as much. So there are things that you can do to help with expanding that bladder. You may need to work on some scar tissue mobilizations, seeing how you can stretch that area. Like lotion, motion is lotion, I always say that, lotion is motion, same thing. So there's different things you can do. Working on abdominal expansion, belly expansion, stretching those muscles, stretching your abdominal wall, working on increasing the range within your hip area, because the way you do stretches help open things up. So you may not be able to fully stretch the bladder, but you can do things around the bladder that'll help give it some flexibility so you can lose some of that stickiness up. You may need to work on, again, scar tissue mobilization. There's different tools that pelvic physical therapists can utilize to be able to do that. Sometimes using dry needling that we can allow, that can help stimulate some blood flow in that area so things can do what they need to. So just giving you a couple things just to realize that there's ways that you can do it, because you may feel like, hey, it's not only am I going to the restroom frequently, I'm also having this like low-grade dull pain that just sits right over that area, over that incisional area. You may lay on that side or lay on that particular area, and like, it's just very tender. That tenderness, if it wasn't there before the surgery and then it's there a little bit after the surgery, you're not making it up. It may very well be scar tissue. And if you increase the stretch, the flexibility, the mobility of that region, you can help loosen up that scar tissue So then it can stop limiting you from the things that you would like to do. Maybe bend a certain way. Maybe you want to go to the restroom and not go as often. So just realize scar tissue can be a hindrance to other things that are going on that's changing the quality of life. No, you're not making it up. No, you're not crazy. Yes, you may have been able to go to the restroom when you wanted to, how you wanted to, and when you wanted to. But then after you had that baby, had that C-section, after you had that hysterectomy, you just feel like you're going very frequently. Or you may be having a dull, ache, low-grade pain. You may even be having pain with sex. You know, when you try to get your groove on, right? You can't because some of that scar tissue blocking the love life. So if this is something that you're dealing with, realizing that there is help for it. Pelvic physical therapy can help. If that's something you will need assistance with and you're in this area, I'm more than welcome to assist you. And if you're somewhere outside of the South Carolina area, there's other therapists as well in your area, so definitely check. So I want you to not live in silence. I want you to live out loud. I want you to live your best life above, but importantly, below the skirt. And to do that, you have to be educated, you have to be empowered, and with having that education, that power will allow you to take the tools that you need so you can go live your best life below the skirt. I look forward to seeing you again next week, Tuesday. Be safe.